in economics.
Sorry.
I have prepared this presentation as kind of a resource toolkit to help in the development of policy and programs in the state. So because economics encompasses many human behaviors, my goal is to provide the kind of a comprehensive perspective about the different aspects of how cannabis is going to impact different levels of society. So to be clear, I'm just going to provide an overview of this information. However, my intent is to give open access, like Heather said, to the presentation so that people can refer back to it and use it in their deliberation of solutions for Kansas. So I'll start off by saying that my heart has always been and will forever be in the Sunflower State. I'm a lifelong Topeka with experience in campaigns and policy, as well as a working knowledge of farming practice. My family still farms in Northeast Kansas. I'm currently a crop adjuster in Eastern Kansas. I have a degree in public relations and a minor in sociology from Emporia State. I have also earned multiple cannabis and drug policy certifications. Continuous learning and data have always been a passion of mine. So I'm probably going to talk fast because I've got a lot of information I want to share. But I was very fortunate while contracting with the Kansas Department of Health and Environment through a local nonprofit to be trained in risk communication and data research by Centers for Disease Control and Prevention. And since 2015, I've been involved with the legalization efforts and to get the reintroduction of industrial hemp within our state. So I believe it's paramount for us to understand how we got to now and to have a better understanding of where we need to go. And so the main topics I like to go over are coming to terms with our shared reality regarding drug policy, and then what the known impacts are of legalizing cannabis, and then finally, what legalization might look like in our state. So to start off, it is important for us to acknowledge that as of right now, 1 in 5 people across the world is imprisoned for low-level, non-violent drug crimes. What's an even more concerning trend is up to 80% of women in prison are there for that same reason. Those statistics are from the International Center for Science and Drug Policy and University of Geneva. Now, in Kansas, the so-called war on drugs has its historical roots in the movement that demonized a different substance that proved to be beyond prohibition's control, alcohol. And we all know about Carrie Nation and the temperance movement, but a fact still needs to be acknowledged that once alcohol was legalized, that lingering sentiment of equating substance use with bad morals was quickly embraced by racist ideologies. And it's worth pointing out that 1 year prior to the 21st Amendment being ratified in 1932, a horribly characterized and biased piece was written entitled Marijuana with an H. And it just so happens that propagandist editorial was authored by 2 men from Wichita. And one of them was a officer with the police department. Now, to add new data highlighting the racist origins of cannabis prohibition policies, the Journal of American Medical Association just published a study last week showing that the differences between states that have legalized and decriminalized compared to those who have not updated drug laws, the trends are pretty clear, as the researchers concluded that increases in arrest rate disparities in states without either policy highlight the need for targeted interventions to address racial injustice. Because we know that the prohibition of cannabis has primarily targeted people of minority. Now, things have changed a lot since California first legalized medicinal access in 1996. This map shows the most recent activity since the 2020 election. And this is important because it shows that all proposed ballot initiatives passed. That's an option we don't have in Kansas. It requires 2/3 vote of legislature to get on a ballot. So this proved cannabis is a nonpartisan issue, and it was also deemed essential by legal states at a very vulnerable time when the COVID-19 pandemic was in full swing. There are reports that have shown trends of cannabis sales in legal states have increased amidst the pandemic. So this will be an area to monitor as years go on. Now, while it is true, technically cannabis is still federally illegal according to the DEA scheduling, not only is the multidisciplinary pressure to update laws based on scientific evidence reaching a tipping point, but the state's patchwork of regulations has been given pretty much a green light through the hands-off approach demonstrated by the US Department of Justice. And that began with the Cole Memo of 2013. Even then, Attorney General, he instructed prosecutors to use their discretion in 2018, but the majority of low-level nonviolent cases are still not pursued. So I think this is important when we're talking about the federal conflict with states. Now, as we know, science is always advancing, and as Heather said, we're finding out new discoveries and potential risks. A lot can be said about regulation at the federal level, going clear back to the question of whether, based on evidence, THC should have been included in the Controlled Substance Act of 1970. But what we know today is our current drug scheduling scheme is not based on harm or toxicity of scheduled compounds. So for example, these charts show known cannabis rankings compared to other substances, including ones that are legal and have enjoyed commercialized markets that have driven economic revenue for decades, including tobacco and alcohol. Now, over time, different disciplines have come to better grasp this kind of problematic situation we have with drug policy, and now how enforcement have certain policies that have not been successful. But I think that it's important we point out that this isn't solely a failure of the enforcement of laws. Okay, it's ultimately a policy issue that was originated through a misinterpretation of international drug treaties. And I'm happy to share more information on that specifically if anyone's interested, but that's kind of a topic of its own. If we are, objectively to evaluate the success of things like prohibition, we have to look at its initial goals, right? Which are to limit the supply of drugs, decrease diversion to illicit markets, and improve the safety of society. But unfortunately, what we found over time is those goals have not been achieved for multiple reasons, including economic ones. Reviews have found, like shown here, that there is both an adverse impact of drug law enforcement on levels of violence and a consequence of the policies on societal harms through limiting access through essential medicines. And I'll get to more a little bit later on that. But this quote up there is I believe, important. What states are legally required to do under the UN drug treaties is exceptionally risky from a human rights perspective. Because they have to arrest, prosecute them, apply criminal sanctions, eradicate crops, which we know about in Kansas, and prohibit cultural and religious practices. So in 1986, so we've known about these kinds of situations for a while. 1986, an economic analysis was done of drug enforcement, and it found that a campaign to limit the supply of marijuana was not successful. That was due to prices not following an expected trend. So additionally, over time, there's been a demonstrated inverse correlation between law enforcement spending and homicide rates, shown there in the graph. Ultimately, what has happened since the 1990s is a decrease in homicide rates despite the exponential increase of law enforcement expenditures over time. Another important quote there from the International Center on Science and Drug Policy: the available scientific evidence suggests that drug law enforcement efforts will not meaningfully reduce supply or drug-related violence, and may paradoxically increase violence in communities. So it's been identified by the Drug Policy Alliance that we're now reaching historical levels of tax dollars that are spent on the war on drugs, which equates to a war on people, given the human rights violations of zero tolerance laws. The main economic problems that are created and exacerbated by enforcing prohibition is it sacrifices a regulated industry that has the ability to control things like quality, quantity, and price. And instead, the result is criminal activity, which just fuels corruption and violence. We know this. And I do believe the quote from retired police chief Joseph McNamara from San Jose, California, rings some truth. Okay, so it says alcohol and tobacco are far more dangerous drugs than cannabis, but no one is being killed in an alcohol or cigarette black market because those drugs are legal. This slide shows just how much our prison have increased in population over time. And despite all the efforts to the contrary, the inverse trend of heroin prices going down despite purity increasing. So this is another a good quote, I think, from Albert Einstein. You know, the prestige of government has undoubtedly been lowered considerably by the prohibition law. For nothing more is more destructive of respect for the government and the law of the land than passing laws which cannot be enforced. It's an open secret that the dangers increase of crime in this country is closely connected with this. One of the impacts of this has caused a kind of distortion of incentives. For example, it could be argued that, you know, civil asset forfeiture that was talked about last week are damaging to individuals and communities and visitors to our state. A recent example here is it happened in Missouri at the end of October when it was found that I believe a car had cash originating from a legal dispensary in Missouri. So these are the kinds of issues that have now come up given border states. And we've been seeing that to the west for years now. It is important to remember, though, that numerous states have deemed asset forfeiture laws unconstitutional years ago. Kansas now carries a D- by the Institute of Justice, citing poor protections for innocent property owners and third parties, and that 100% of those proceeds go to law enforcement. So there is room for, you know, some improvement. Now, to be clear, my only intent here in showing this is to demonstrate what has happened and how we can engage and work together towards mutually beneficial solutions. So as I'll get to in a few minutes, law enforcement is absolutely key. It's a key component in cannabis regulation. So when we look at different numbers of law enforcement agencies throughout the state, we can see the complexities of funding from state sources, you know, which has increased over time, as shown here in these tables, funding to the trust fund, federal grant dollars from the state. You know, there's a lot of sources. It's complex because it takes a lot of money to run facilities and salaries. When we're reviewing things like, you know, limited public data about audits from, say, the U.S. Justice Department, 2020 and 2021, we do see some violations in, you know, federal compliance systems and expenditures. My point in sharing this, though, is perhaps lawmakers may have a better access to information about publicly funded entities such as law enforcement agencies, but a few questions that maybe are important for lawmakers to consider are things like who audits all money from all law enforcement agencies and organizations? Who do they report to? And ultimately, what are the effects of some of these policies? Because ultimately, we don't know what we don't measure. And that's what we're finding out with regards to cannabis as a whole. All drug policy is an evolving endeavor. And I believe that the Swiss model for drug policy is a really great one to look at. It stands on 4 pillars: prevention, harm reduction, treatment, and law enforcement. And, you know, when we're creating cannabis policy, we also need to be thinking about principles of what makes something sustainable. So, you know, it has to be good for the environment, for social, economic aspects. So if agencies and organizations can work together towards that same goals and positive, sustainable change, that can actually happen. Overall, even though we're talking about cannabis specifically, the goals of comprehensive drug policy are similar for many stakeholders. So things like stopping infectious diseases, epidemics, addressing deaths by overdose, reducing crime. I mean, all of these things we want in our communities. So those are the things that we're coming to the table to talk about. Based on the evidence I'm about to show, I do believe there is a much needed shift towards harm reduction, and that includes things like decriminalization and legalization of cannabis. Now, I've highlighted here some necessary programs that are said to have need to be in Kansas. These types of educational and prevention programs are examples of efforts that can be supported by revenue from a regulated cannabis program. So even though there is kind of maybe a conflict between the current abstinence-only drug-free society and the public health approach, I think there is a middle ground that we can all come to terms with, because we're facing multiple crises. And what we know is the number of overdose deaths in Kansas have risen 210% from 2000 to 2018. In the graph below, you'll notice that the overdose deaths rate in Sedgwick County has increased the last 12 years, despite the fact that dispensing has dropped considerably. I had data pulled here for other counties, including Wyandotte, Shawnee, and Douglas, and the trends were all similar. This is very concerning, and what this means is that even though medical providers are dispensing fewer opioids, which is both good and bad, since it can also limit essential medicine for other patients, people are driven to riskier behaviors, including use and accessing opioids through potentially illicit means. The same thing can be said for cannabis. That's why it needs to be regulated. It has also been shared through multiple data sources that cannabis can be considered an adjunct therapy, and in some cases a replacement for such treatments. Now, according to the Vera Institute of Justice, even though the overall trends for jail population in Kansas are moving in the right direction, the number of overdoses happening in Kansas jails is a tragedy, and it has to be addressed. This slide has just a few of the most recent peer-reviewed publications in cannabis-based research, of which the total number is now in the hundreds of thousands. We're kind of on the precipice of an enormous frontier of data research involving cannabis. Now, it has been demonstrated in Canada that people who are registered cannabis patients utilize their healthcare providers more for personal health guidance. Having personally worked at Blue Cross Blue Shield of Kansas for about 6.5 years out of college, I heard a lot of discussion about increasing utilization with medical providers. So monitoring these kinds of data points is going to be important for Kansas, I think, to move forward. To put it lightly, the world, and especially the US, has barely even scratched the surface of exploring the many facets of cannabis. So there's a lot of work to do, which includes better understanding potential risks, and especially for specific individuals and populations. Now, there's a significant amount of information out there on how different cannabis programs have performed in different states. But for comparison, I'd like to focus on adjacent ones to Kansas. For example, from 2019 to 2020, Oklahoma's program provided enough revenue to pay the salary of 794 teachers. And given teachers' shortage in Kansas, it is around the same, according to the Kansas Department of Education. That amount of funding could have covered the entire state's staff shortage. So I think that's pretty crucial. Now, there's a significant, let me see here, this data, this is survey data from 2020. This shows that over 1,000, out of over 1,000 people who were asked, a growing population of 46% said they would prefer to live in a place with legal access to cannabis, while the next highest ranking response was, well, it didn't matter that much. So when people are choosing where to go and where to live, that does factor into the equation. When compared to other industries, the projected growth of cannabis is expected to remain exponential, and that includes both for adult use and medical. According to a 2020 job report, the cannabis industry alone has over 243,000 active employees, and that only seems to be increasing based on trends. Looking at Missouri, there's been a positive revenue increase since their dispensaries came online in October of 2020. The same can be said for Oklahoma, with revenue which has increased over time since 2019. And shown here in June of 2021, the total revenue far surpassed program expenses. If you're not familiar with it, the Oklahoma Medical Marijuana Authority has really good documentation, and it's very user-friendly. So I encourage you to stay up to date through their portal, and it's at oklahoma.gov/OMMA. So one area that has received considerable attention in previous years has been the topic of cultivation of cannabis by individual patients. Last year, around 20 states allowed patient home cultivation. So here I've provided some information about this. And one of the main takeaways is that even though some states have legalized cannabis so patients can grow, there's never been a state that has rolled back those provisions, and there's not been any serious effort to do so either. It's also been demonstrated that just like how not everyone gardens as a hobby, secure home cultivation has actually not shown to have a serious impact on states' revenue taxes. In fact, as we'll see, there can be an economic improvement aspect worth noting. So having watched other states, as Heather mentioned, we have a lot of data to draw upon. We know there is still significant pushback about conflicting findings from more traditional addiction treatment and enforcement statistics. But when evaluating studies, it is important to always remember that association does not necessarily equal causation. To this end, I wanted to share a recent publication by Cato Institute, and it concluded there has been a noted absence of significant adverse consequences from legalization. Another report that was released just last week from Cato said that in the face of alleged associations between cannabis and suicide and mental illness, concerns about the correlation between marijuana use and depression should not interfere with state or federal efforts to decriminalize or legalize cannabis. In fact, legalization will have the salutary or beneficial effect of allowing more rigorous research. So again, we don't know what we don't measure. A concern that has been voiced in previous years is problematic use in adolescents. What we know from CDC data is that from 2008 to 2017, Kansas had a higher change in admission rates for cannabis treatment than compared to our neighboring state of Colorado, which legalized adult use in 2014. This will also be a crucial data point, I think, to monitor over time. The issue, potential increases of calls in poison control centers may be a valid one. However, it is important to keep in mind context in such incidents because, number one, they can be prevented through well-established comprehensive educational programs. And number two, given the extremely low toxicity of cannabis, and although it may be very frightening, of course, for a child, parent, or an individual that experiences an accidental or unintended ingestion, in reality, according to the National Poison Data System, in 2019, 83% of poison control center calls were non-fatal. So I think it's kind of good to keep that in context. When we look at overall poisoning deaths for various drugs, cannabis ranks the lowest. And again, there have been numerous calls for medical providers to be allowed to use cannabis in their therapeutic toolbox. With regards to cannabis and traffic fatalities, there have been multiple studies done, but I want to highlight one that was done right here at K-State in 2019. This study used 23 years of state traffic data and found that legalization of cannabis is neither a factor in the rise of traffic fatalities, nor a predictor of traffic fatalities. As I mentioned, science has given us advancements to know now that there are nuances with cannabis, how it interacts individually with our endocannabinoid systems. There are multiple complexities with things like tolerance, metabolism, windows of impairment. So this is critical when it comes to enforcing things like impaired driving. It was mentioned last week. This is going to continue to be an ongoing area of exploration and advancement and adoption. But again, this is another reason, in my estimation, that legalization needs to happen, because we cannot engage in fact finding if there is no regulatory structure in place to allow the exploration of those types of findings. Interestingly, with regards to crime, it has been demonstrated that in Italy, with an increase of a number of grow shops, there was a reduction in not only of confiscation of illegal cannabis and the number of illegal plants, but a reduction in the number of people arrested for drug-related crimes. So this means while there can be both an improvement in crime, economic development in communities can also happen and thrive. It's also worth pointing out that the 2020 KBI Crime Index reported that even though there have been an overall increase in murders, there is not enough statistically significant data to support any theory about drug-related murders having led to that increase. So what does all of this mean for Kansas? I like to think that we care about all of our communities, and the majority of Kansas is rural. And as you can see by this map, our density is pretty low. And if you see over time, the majority of our population has moved to the urban areas, and there has been a decline in rural populations. At the same time, that bottom graph is startling. The fact that frontier and rural counties are suffering the worst suicide rates, that's significant, and it definitely needs to be addressed. When we consider that the projected change over time in the coming years, and given the average age of Kansas farmers is 58, there are some key components we need to be focusing on. We've got to be bringing back good paying jobs to attract young people in our small communities. We also need and want to make our communities safer and also empower these untapped tourism potentials, right? So although it's been a bit slow with learning curve and weather, we've already seen some really great strides taking place with industrial hemp. And there's now an influx of interest in this expanding economic opportunities and these emerging sectors. And I commend everyone who's participated, especially the pioneers who are doing things correctly and wanting to make it work for their communities. I tend to believe, along with others, that industrial hemp will more than likely far surpass revenue created by medicinal or adult use cannabis, but that's a long-term vision, and it also has many multiple dependencies. But as many of you may know, coming up in January 2020, the Kansas legislature has an active medical cannabis bill. There's another one that was introduced, but I'm going to focus on this because we have the most information about it. This bill was passed out of the House in 2021, and it's currently sitting in the Senate Committee on Federal and State Affairs. And according to the Kansas Department of Revenue, their fiscal note on House Bill 158, it projected that revenue from license fees in 2023 could be $8.1 million and then $14.6 million the following year. They also estimated that sales tax revenue for cannabis could be $1.4 million in 2023, $2.84 in 2024. My personal estimation in these projections these are still kind of conservative. They have to be somewhat conservative. It's at least a benchmark to work from as the state establishes programmatic needs and rules and regulations. And here is a breakdown of those fees for House Substitute 158. And you can see the different tiers for different entities based on their level of participation. Now, comparing to other states like Missouri's program, for example, they charge $25.58 for both a patient and a caregiver card, whereas Kansas patient ID is $50 unless the patient is a veteran or indigent. So, I mean, there are a lot of, back and forth. You can go a lot of different ways. But ultimately, what we know is that, there are 14 sectors that are going to be impacted through the legalization of cannabis, specifically medicinal. And you can see here, these are just two examples of sectors. These are the types of jobs and specialist careers that are necessary to run a fully optimized cannabis program. With our legacy in Kansas of medicine and research, we have so much to learn and incorporate into existing systems. And this is especially the case when it comes to the animal health corridor and animal health research. Given that Kansas sits within the largest portion of the animal health corridor, that's where over 56% of the world's research and development for animal health and products happens. We will continue to see cannabis play an important role, I think, in this sector moving forward. Now, when I look at this slide, I know it says that Kansas is ranked 39th in the US for its economic performance. And I know our cumulative domestic migration is ranked 40th. Along with non-farm employment, being even worse. But to me, these numbers symbolize a beginning and opportunity. And it's a place to start and only improve upon. So we've already seen some great strides taken just within the past few years with new manufacturing jobs coming to the state and programs that are increasing in innovation all across the state. And I commend all of the lawmakers listening to this presentation for your dedication and hard work towards these efforts. The demographics of those who utilize cannabis may be surprising to some, but the largest increase of cannabis use has been demonstrated in older populations. They also want information on it from their medical providers for the myriad of conditions which cannabis is currently being used for in other states. Now, I'd like to leave you with some parting thoughts on some key areas to focus on when deliberating cannabis policy. There's tax revenue, public health, public safety, and regulatory oversight. This model was created in Massachusetts. There have been some really solid examples in states that have put in place programs, and one of them is when considering price, it's an important reminder to weigh the trade-offs. Synchronistically, we just celebrated Halloween, but there is some truth here to this meme's message. And I know it says recreational, I prefer adult use, but the same situation would apply to medical cannabis. So hi, I'm recreational marijuana. Well, you don't seem like a monster. I sell eighths for $75 plus tax. Oh, that's horrible. What this does is, this is a situation where setting a high tax on cannabis does produce revenue for states, but it can also drive more consumers to illicit markets. So there are some crucial aspects that have to be considered. Luckily, there are organizations like the Kansas Cannabis Coalition and the Chamber, the Center for New Revenue. I'll provide some others in the resources here. But in addition to the Cole memo and states that have branched out on their own, an arrangement that we've seen and may see more of as time goes on is the Cannabis Compact. California and Oregon have ventured down this path, and it's anticipated that similar arrangements may occur in other regions, kind of considering what happens federally, of course. But it may help efficiency and transparency of data and regulatory programs. This opportunity can be available to Kansas, but only if we, participate. And finally, the graphic here from world-renowned drug policy expert, Dr. Julian Buchanan, it shows a balance can be possible between an unregulated, criminal, and legal market that also protects public health of our communities. And I would like to say, as Kansans, one of our biggest strengths is we know how to work together. And it will be challenging and ever evolving, but based on available evidence, I believe through collaboration that we can make positive change for the better. I hope this presentation has provided you with some valuable information, resources, and feel free to reach out anytime. I'm more than happy to send you any type of information. And Heather, I'll shoot it back to you, and we can have some questions if there's time.
Awesome.
you.
Yes, there is. Thank you, Kelly, so much. You're so wonderful with research and data, and that's not my strong suit. So I appreciate you taking the time to put that together for us. We don't have any questions in the chat yet, but I have made several notes that I was kind of hoping we could touch on that we've seen have been points of interest for not only legislative body, but for the public. So one of them that I kind of want to talk about is the slide you had about the declining population. Recently in a leadership class that I was doing through Overland Park Chamber, there was a note about 80 counties in our state have seen decline in population over the last 5 years, which is, there's 100 and not many more over 100. Sorry, I forgot the number, 105 or something. So that's a pretty significant amount of population decline for the state. And when you are talking about losing people and losing them to other states, that's money. That's revenue that is walking out of the state's doors. And then you had that slide on people when they look for a place to live, they want to have access to medical cannabis, or it really doesn't matter too much one way or the other. But what we didn't see is people saying, I want to go somewhere where there is no industry or program at all. So, what are some ways, especially in those rural counties, that we can not only increase population or engage younger farmers, but what are ways that we can, turn those into opportunities for people through a medical program? I mean, is it the cultivation piece of it? What opportunities there will be good for population increasing and good for the state?
So I would like to go back real quick. Please excuse the constant clicking. I'd like to go back. This is, I think this is a pretty good slide that can show the types of jobs that are going to be necessary. Yes, you are correct. We have to engage young farmers. It's currently happening with industrial hemp as well as older farmers. Older farmers are wanting to get involved with this as well. There will be I believe a complexity and nuance given our resources in Kansas. So you get out to central and western Kansas, and there is a scarcity of water. If we want to be truly sustainable in cultivation, we're going to be using, low input varieties and which may mean that there may be more industrial and fibrous varieties out there. However, there are going to be indoor cultivation facilities, and that requires all of these types of jobs. So cultivation is just one aspect. There is a myriad of sectors that are, and I do, they're further down on my presentation. So if you go through that later, you can get to it. But, all the way from media to patient services to, there is a wide variety of individuals that are going to be needed to make this a responsible and regulated program for communities. And you're absolutely right. We have got to bring people back, and I think it is starting to happen in some areas. But we need all of the all the tools in the toolbox that we can to achieve that. And so I think in putting in place a medical cannabis program is going to do that in a lot of different ways.
Yeah, I agree. So the other piece that I wrote down too, the K-State study on the impaired driving. Was that done? You said it was done over 23 years. Was that done on medical programs or recreational, or a combination of the two?
That's a great question. I believe it was over both, but I would have to go back and double check. I do believe it was medical because it included California's data, which going back to, you know, the 90s when it legalized, that was medicinal. So I believe it is both, but I'd have to check if it is exclusively medicinal.
Okay. Yeah, that would be great to know. Just I think that those are kind of important pieces when you're talking about data, especially you know, when you're presenting it to, as we present it to legislators, just being able to have as clear and concise as possible.
Yeah, it is both. Sorry, it is both medical and
Okay.
recreational use.
Great. That's great. That was definitely a hot topic of conversation last week as well. So we do have a question from the chat. It says, we've talked about the economic impact of legalization in Kansas, but what will the economic impact be to Kansas if we continue to prohibit the use?
That's a great question. And I could probably come up with a presentation that is equally in depth because that's a complex thing, you know. Given if you're asking me personally, just point blank, given what we know of data now, I don't see anything that would change. We would continue to see civil asset forfeiture happen with all of these states around us becoming legal, trying to go through our state. People's human rights are going to be continued to be violated. We're going to continue to have people dying from cancer who don't have access to therapies that could help them live potentially longer or improve their quality of life in their final years. I mean, there's a myriad of data points that can be put on that, and quite honestly, a price can't be put on some of it. So that's pretty much what I can say about it.
Yeah. So you know, there's a lot of discussion on the federal level for descheduling cannabis, which is great. With that comes, you know, the interstate commerce and really broadens the industry for really large businesses. And it's been a concern of mine for the small businesses in Kansas that other states have had years and years to allow their, you know, small businesses to get off the ground, you know, develop their plan and their business in their state. And with Kansas not having done anything, and if they don't do anything, if Kansas doesn't do anything, and this goes federal, I mean, that really does just put a complete snuff and thumbprint on any sort of small business advancement for, you know, people here in our state. So what is the best way to kind of explain that, or what types of data points can give us there to use those for talking points when we are talking to legislators to let them know that this is important to do now? Like, Kansans deserve an opportunity to thrive in this market, just like 47 other state residents have had the opportunity to before descheduling, which it should be done. But it's also kind of just like from a small business standpoint, which is where my brain goes. I'm like,
I think if you ask Kansas lawmakers, I can't speak for them, but I think if you were to ask them, they would say that they've been hearing it from their constituency for quite a while. So they know that something needs to be done. And one of the, I guess it's not a talking point. I mean, the reality is that people, regardless of whether you participate in a legal cannabis program or not, you're still going to benefit from having that program in place. And that means that, you know, economically, we're going to see a change in the way that businesses operate, in the way the state operates, in the way that public health agencies and law enforcement interact with communities. I mean, it brings about a large transition. And that's why this is such a lofty endeavor, and why it requires so much education and data, you know, all of this stuff. So I don't, you know, that's all I'm here for. I'm just here to share the data. And I think that this slide here, we haven't had time yet to really delve into, but there is an association with racial disparity in cannabis. And I think that one of the graph here down towards the bottom left hand, that is showing the change of legalization and decriminalization and no policy change. And those are the types of data points that I think we can try to understand better and try to extrapolate how that may impact our local states and communities.
Yeah. Well, thank you. And like I said last week, and I will totally reiterate that this week, all we want to do as a chamber is be as supportive as possible to the powers that be as this industry rolls out, to law enforcement, who even you in your presentation pointed out it is essential to the success of this program. We want to be as supportive to law enforcement and our legislators as possible. So if there's ever any questions that anyone has, please let me know, or reach out to Kelly. He's better with numbers than I am. Happy to facilitate that email introduction. But that's what we want to do, being able to access and look at this data and dive into it, hopefully we'll be able to answer a lot of questions that people have. We have one question here from Nick. Do you have any opinions on the direction that the 2022 legislative session will bring regarding this topic?
It's a great question. And everything right now is pure speculation. So I guess what I can say is that as mentioned before, lawmakers have heard about this for multiple years now, several years, and I know that they are and have been communicating about this. There have been some outside meetings and events and things like that. So the conversation is there. It already was last year. There was movement, and I think the momentum is there to probably get something done, hopefully sooner than later in the session. But again, it's not over till it's over. And under the dome, anything goes. There are a lot of priorities that people are bringing to the table too. So I think we need to keep that in mind. But my hope is that we can get something worked out and passed for all of Kansas.
Yeah, I would agree. Does anybody else have any questions or comments that they'd like to share? All right.
I just wanted to share that that I'm with Kelly. I think the momentum is there, and until I became more active in the political arena, I did not realize the vast amount of information our lawmakers are required to know to make laws for the state. I mean, it goes everywhere from education to medical cannabis to taxes. I mean, it's so much. And this year, more than past years, they want to be educated about cannabis, about medical cannabis, and they're asking the questions, and they're wanting to learn, and they're wanting to put together a good program. And that is a huge positive that hasn't always been there. So I'm crossing my fingers.
and to that point, Amy, thank you for that. The call to action is tell your lawmakers that this is important if you believe it is, and let them know that that this is important to you and what you know about it.
Right.
Yeah. Well, if nobody else has anything, I will go ahead and conclude our presentation for today. So thank you guys so much again for attending. We appreciate it, and we are here to support and provide education and information in any way possible. So please don't hesitate to reach out to myself or Kelly. I will be sending out a follow-up email to everyone who came to the meeting tonight with the PowerPoint so that you can dive deeper into some of those statistics if you'd like. Otherwise, we will plan to see you guys at our next webinar, which we don't have one scheduled, but we'll be making an announcement soon. Thank you, guys. Thank you, Kelly.
Thanks,
Thanks,
Heather.
Kelly. Thanks, Heather.
Take care.